Hi, and welcome to Lifestyle Wellness Group podcast, aka Blondes with Brains. Today we have a special guest. My good friend Cindy Steele is with me. Welcome, Cindy.
Thank you. Thanks for having me.
You are very welcome. So, Cindy has an awesome story, guys. She has really turned her life around in the past 2 years. I'm going to let her share some of her story with you, but previously she spent her early 20s in and out of cancer centers, and now she is a thriving, out of the hospital, out of doctor's appointments. And I just wanted you to kind of share with everybody what's been going on over the past 2 years and what was a trigger to changing your life around over the past 2 years?
Sure. So the trigger was simply my health was declining rapidly, similar to what happened when I was in my 20s. And I was diagnosed early 20s with an unusual tumor growth throughout my entire pelvic area and my lymph nodes. And fortunately made it through that period of time, about 10 years in and out of cancer clinics. But about 3 years ago, I started getting sick again. New tumor growths, bleeding ulcers, unusual eye problems, just really my immune system, I think, was crashing. And so I had to look at what I could do differently so I didn't end up in the same situation that I was in the past. And I met you, and we started looking at my diet much more aggressively. So changing my diet the last two and a half, almost 3 years has made a huge difference.
Now, when you were in your early 20s and you first, like that first time that you realized something was going wrong, like what were the signs and the symptoms back then?
So I'm glad you asked that. I was thinking about that earlier today. I actually had symptoms, I believe, starting when I was maybe 19. Being 19 and going to a doctor and saying you have some unusual stomach problems. It took almost 2.5, almost 3 years, actually 2 years before I was properly diagnosed. So I was in pain. I had a lot of pain. This type of tumor growth wasn't showing up negatively in my blood work. It was a very rare type of a tumor growth. So I was simply in pain for a couple of years until I finally got a doctor to, they diagnosed me with everything from endometriosis to just, colitis, things that were all stomach related. So I just kept going to more doctors. I had to be firm in the fact that there was something wrong with me, and someone would have to listen, but it took almost 2 years.
And you were chronically living with that pain. So you're sitting there chronically living with that pain. Was it like on a daily basis, or would it come and go, or?
So it got to the point where it was on a daily basis, but even with this, I was always active. I started working out, doing kickboxing and running and weightlifting in my 16, 17 years old. That was something that I liked to do, get outside and be active. So even throughout my being 19, 20, 21 years old, I was still trying to work out. But I remember being in the gym and doing sit-ups and having to stop because I was in tears just from trying to do a sit-up. So it affected, the tumors they were adhering to organs, they were adhering to each other, they were pulling on different things. So my intestines were being bound up, everything. So think about just trying to stand up or roll over in bed. I could roll over in bed sometimes and just, end up in a ball of cringe because things were pulling and tugging that shouldn't be pulling and tugging. So it was simply a pain issue with me.
So at the beginning, did you take like ibuprofen to relieve pain, or like you were just taking over the counter stuff to say, okay, I've got this pain and I want this pain to go away? And I
Right.
think this is what people do a lot. They have pain and they don't listen to those signals of their body. They just try to mask the pain. And
Right.
so were you trying to mask the pain and then it just got to a point where it was just too much?
I was, and at one point I tried starting to do more exercises similar to yoga. This is back before yoga was super popular. I do a lot of it now, but I started doing more stretching. I figured, okay, something's, I need to work out harder. I need to stretch better. Something different needs to happen. But even though I took over-the-counter medication, which I believe definitely contributed to some stomach issues later in life. But I also had a doctor who felt that I had some type of a bladder type condition, another one a uterus condition. So I was given other medications that I didn't need. So I did try even some prescription medications.
So you were probably misdiagnosed several
Mhm.
times along that 2-year journey.
I absolutely was. I remember even calling one of the doctors who had me on, and forgive me, I can't remember the medication, but it was more female oriented, kind of something maybe close to endometriosis. And I called after finding out what I really had, and the doctor wouldn't even get on the phone. I left a message for him to call me that I'm no longer taking this medicine. This isn't what I have. And he didn't even, I'm 20, 21 years old. He didn't even have the courtesy to call me and listen to what really was going on, because I really didn't want another young female to go through that misdiagnosis, and putting things in your body that you don't need can have negative effects.
So I got a question for you. So what would your message be to somebody because I think a lot of people are going through this, right? I think a lot of people are in pain, because I talk to them, daily. I talk to a lot of people that are in pain, and they're going through the same thing you went through. So now that you've gone through it, you have the experience of it. So what would your message be to your 19, 20-year-old self that was in pain at the time, that didn't know any better? Like, what would your message to them be?
So you know your body as well as anyone, so definitely listen to it. And if you're not getting what you feel are the right answers for you and for your health, then keep searching them out. And I think what I know now compared to then is there's a lot more resources out there. I didn't seek nutritional guidance until my late 20s, when I realized I wasn't getting much better, and there was something else I was missing. But your early 20s, young females, know your body. Seek out the proper advice for yourself, and also continue to stay active, because you have a golden opportunity to set the stage for habits for life, whether that's nutritional, working out, taking control of your health, not putting it just in someone else's hands. Not to discredit our physicians, but there's so many things out there, so you have to stay in control of your health.
I think you brought up two great points. One, nutrition. I think a lot of people miss the boat on the nutrition, looking as if that can be a way to help alleviate some of the symptoms. Okay. My number one thing is that, let's rule out something structural, right? So pain is a result of inflammation and you pinching off a nerve, or getting, there's something that is not aligned correctly, whether it is, your neck could go out and it's pinching a nerve, or there's some kind of inflammation on one of your organs or your stomach lining or anything, and it's causing discomfort because of the extra space that it's taking up, right?
Right.
And so my one thing is always rule out structural, right? So, like, example with that, when is the first time that you had like an ultrasound, or when was that put into the picture?
That was my late 20s, because I actually received my diagnosis the week of my 21st birthday. So thinking back through that, I know my when I was 19, I really didn't get very far, but in my 20s, I was finally starting to get some proper testing. So my first ultrasound would have been in my 20s.
in your 20s. And then in your 20s, when you got that ultrasound, and then they did see some structural
Mm-hmm.
issues that were going on because you had those tumors, then they put you into the cancer centers, correct?
Well, no, first, still the doctor was insistent that I probably didn't have anything other than a very bad case of endometriosis. Um, and so we went to the hospital, and he wanted to do the laparoscopic and actually take a look. So
Mm-hmm.
I had that procedure, and it was after that and that was in Florida. And the week after that, I was sent out to Houston, Texas, to MD Anderson Cancer Center. He finally sat by my bed and said, "I'm sorry, and I should have listened to you a little bit longer, but here's what we're going to do." So that started me on the path of visiting cancer clinics.
Okay. And when you visited the cancer clinics, you were given some experimental treatments, correct?
Yes, correct. Yeah.
Okay. And how
So
long did that go on for?
um, almost 8 years. I would fly back and forth to Texas the first few years, and I would receive experimental treatments. They would give me medication normally used for men for prostate cancer. They would give me tamoxifen, which is really geared more towards breast cancer. Obviously, I didn't have either one of those. And a few other experimental things that honestly, I was young, I can't remember what they were, but I do remember um, getting out there on one of my last trips, getting off the plane, and I was determined they were not going to give me an injection that next day. So the next day I get to the hospital, and I'm sitting in the room waiting for the doctor, and he comes in, and I stand up and I say, "I'm not taking that. You're making me," I was worse, I believe, by taking what they were giving me, because it was all experimental for them as well. They had, I'm sure, good efforts with what they were doing, but they didn't quite know how to treat me. So it was a practice, right? So I said, "I refuse to take that." And he actually said to me, he said, "We should have never have been giving you this." It was only my second visit with this particular physician. And from my visit prior to that, he had researched what I had been going through, as a patient there. And he said, I'm not in agreement with what we've been doing. I wasn't going to give it to you anyway. So there was another shift.
Mm-hmm.
And then that was me, figuring out that I had to take control of my health, because what was being done to me, I felt was worse than monitoring the true source of my problem.
And you bring up a great point. You have to take control of your treatment and your course of action.
Right.
And, in the last 3 years, before we met and you started to decline again, we've discussed this. We think it was because of the issues or the damage that was done in your early 20s with those experimental medications and the trauma that your body went through at that time. Now, at your late 20s, you started integrating nutrition into it, and you saw some relief from that, right?
I did. I growing up, I didn't eat well at all. I lived in a couple of broken households, kind of fended for myself a lot as a kid. And so I just simply did not have a good diet. And that carried through into my early 20s. Even though I was working out, I enjoyed doing that. I would implement a protein shake here and there, or, think I'm eating a salad and that's going to help me out for the rest of the week. But I really didn't have good nutritional guidance. And so at one point, I made an appointment with a nutritionist, and this was still going to the cancer clinic every 3 to 6 months for checkups. And I just really, the older I started getting, the more I realized there's probably some other things I could do. So I sought out nutritional guidance, and I realized what a terrible diet I had. And I made a lot of changes that I could feel immediately. I could feel that my stomach just felt better, and my skin started looking better. And I figure, okay, if I can see that right away, then it's got to be doing something good for me. And so I did. That started my nutritional journey of paying more attention to what I eat and drink.
That's awesome. And then, so you started that journey 28 till 40, and then And with age, just like everybody else, with age, our health starts declining again. So now in your late 40s, your health was starting to decline again, even though you were following the nutrition. She just had to like level up a little bit, right? And
Right.
so, you went back into some allergy stuff, what other things were you dealing with? Stomach issues?
Serious stomach issues, bleeding ulcers. I ended up with an odd infection that affected my kidneys. I was in the hospital. They were about to shut down. Have no idea how that happened. Some type of infection. I was having eye issues again. When I was in my 20s, and I do believe this was after about 3 years of taking some experimental treatments, my eyes would swell in the back like an arthritic joint. So now I was going for steroids, for my eyes. So I was starting to repeat some of these things that happened back then, but it was more aggressive. I'm in my 40s, and so it was harder to. I felt it was going to be harder to fight that, and I really needed to gear up my nutrition. It was the only thing that I've really leaned more toward changing, is just making sure that I do better with my diet, water that's alkaline, more plant-based than meat-based. And I think on another note, fast forwarding to my 40s from my 20s, I believe that there's more pesticides that are used with our food now. I believe the quality of our food is not quite as good in some cases as it was back then. So I think now even more so, I have to supplement and pay more attention to what I'm consuming.
Right, right. And so you leveled up. So when we met, you had just come out of the hospital,
Yeah.
and it was time. She was ready and geared up to level up, and introduced a supplement line that we recommend, plant-based supplement line that follows our philosophy of cleanse, balance, build, and love, and making her body alkaline and just flooding it with nutrition so we could, one, detox all of the things that she just mentioned, the pesticides in our food, even the pesticide, the air, the environment, the toxins. We come in contact, I've said this before, we come in contact with thousands of pesticides or toxins on a daily basis that no matter how clean you eat or how much you supplement, you're still going to come in, they're environmental toxins. Unless you live in a bubble, you're going to come in contact with them. So leveling up with that supplement system that we recommend, that really changed the game. So over the 3 years that we've been working together, so you had 3 bad years where you're starting to decline, and then we met, and now it's been 2 or 3 years that we've been following this path. Where are you now?
So, excuse me, I do not see anyone at a cancer hospital or clinic.
Yeah.
I have not had to do that since the last episode in the hospital. And I take nothing over the counter, no pain medications, nothing for allergies. It's just like night and day again. So my doctor bills are down. I hardly ever have to go to the doctor anymore because I know how to supplement and take care of myself, my body, through nutrition, really. So it's changed dramatically.
That is awesome.
All for the best. Yeah.
So what's the number one change? Like if someone's listening to this podcast right now, what would you say like is the number one most important thing to change immediately?
Your diet. There's got to be something in our diets that we can change immediately, whether it's drinking pH balanced water versus tap water. Anything that you can put into your diet to alkaline your body, I would do that immediately. In my opinion, a body that's alkaline can, your body can do what it's been made to do, and it can fight off disease.
Absolutely. Absolutely. That's so important. It's so important to keep our bodies in an alkaline state where inflammation cannot exist, because inflammation is the root of all disease. So if we can get that inflammation taken care of, that disease process will never start. That's so important. I have another question for you. So what would you say if there is a person that is dealing with a cancer diagnosis right now, cancer, abnormal tumor growth diagnosis, what would your advice be to them to save them what you went through?
Sure. So know that you have options. First of all, don't give up hope, because there's so many things that we have so many resources these days to help you get better, right? So you don't give up hope, regardless of what the diagnosis is. Know that you have options. Don't accept just one person's opinion. I would always get another opinion, and I would definitely seek out nutritional guidance at the same time.
Mm-hmm. Awesome. That's great advice. I'm sure we have some people listening today that are under that strain. Nobody ever wants to get that diagnosis, and I'm sure your words of wisdom and your story have inspired them and given them hope. So thank you so much, Cindy, for coming on today.
I appreciate it.
Thanks.